What is up, you guys? Austin Marks here. Today I'm going to be talking about why respiratory therapy is potentially the greatest thing you can do before going into PA school. First off, I just want to start out by saying what my channel is about. So not many people know what respiratory therapy is or what we do. So my goal is to basically make respiratory therapy more prominent to the public, hopefully get more people to go into respiratory therapy, become a respiratory therapist, because it's a growing field, demand is growing, and we need more respiratory therapists. So with that being said, I'm going to jump right into the video. So like I said, it's going to be why respiratory therapy is the greatest thing to do before going to PA school. So I have 5 main points. However, I'm going to start with number 5, and number 1 is probably the greatest, so make sure you guys stick around for that. So number 1 is you're getting patient care experience as a respiratory therapist. So the quality as well as the quantity is just tremendous. So you work a full year as a respiratory therapist and you're getting about 2,000 hours. So I know Penn State, their PA program of 2019, the class of 2019, they had about almost 4,000 patient care experience hours. So that's a lot. That's almost 2 years of full-time work. However, if you work part-time for all 4 years, that may add up as well. With that being said, number 2, the experience you get with these patient care hours. So respiratory therapists, we will go to every code as well as rapid response. A code is when someone goes into cardiac arrest, so therefore their heart stops and we need to go and start CPR ASAP. So we will generally be at the head of the bed giving resuscitation breaths. However, if there's not many people in the room, we will be pounding on the chest, making sure that the heart is pumping with our pace and that the rest of the body is diffusing, the brain is getting oxygen, things of that sort. Now, rapid responses. So basically, we will go into the rapid response because it gets called overhead. Say room 412, rapid response, room 412. So we go running. It can be anything from the patient's blood pressure dropping, their oxygen saturation dropping into like 85, 80 range. Maybe they're having signs of a stroke. So we get there, we see if they need any oxygen, anything that we can do. If not, we generally leave. However, if they're having like a stroke, signs of a stroke, the nurses, doctors, they'll bring them to CT scan and they'll just see what's going on from there. However, we're not really involved unless the patient needs any respiratory assisting or anything like that. So traumas. This is probably my favorite part of being a respiratory therapist. I've seen many cool things. I've seen stab wounds, gunshot victims. I've seen people fall from 100 feet, car accidents, anything that a patient need to come in the trauma bay for. So when they come into the trauma bay, they'll go ahead and we generally will intubate if it's severe enough. If they need to help protecting the airway, the anesthesiologist will be the one who intubates, but then they'll hand them right over to us. We'll hook them to the vent. We'll make sure that they're breathing correctly, that they're getting the oxygen they need. Sometimes we put them all the way to 100% oxygen, so they're getting nothing but oxygen because their body's this severe. It's metabolizing this much, and they just need oxygen. So with that being said, intubation. So this is when we stick a tube down a patient's throat because they need airway protection or they're not ventilating correctly. There are a couple other reasons, however, I'll make another video about that eventually. So we help put the tube in the throat. So we will go ahead and we'll bag the patient, give them mandatory breaths beforehand as well as afterwards because we'll basically knock the patient out when we go ahead and intubate. We'll sedate them, maybe neuromuscular blocking agents. It all depends whatever the doctors or nurses want to do. So we'll assist with that. We'll maybe pull a stylet out, the bougie, anything like that. If you don't know what those are, if you go to respiratory therapy school, you will know. Even nursing, you'll understand what those things are. So another thing with trauma is the ER experience. So some shifts I will be down the ER all by myself for the whole shift. So patients who have breathing problems, asthma, cystic fibrosis, COPD, anything like that, I'll go ahead and give them breathing treatments, or if a patient comes in with a trach, we'll go ahead and basically the nurses at my hospital don't know too much about trachs, so they'll call us to go down and make sure everything's okay with it. So then we'll go ahead and we'll just assess the patient, see if they need anything. Sometimes they even come in on a ventilator, so then if they came from a a long-term acute facility, uh, generally where they're on a ventilator the entire time. We'll come down and basically make sure that everything's right with the ventilator, that the patient's okay. So another cool thing that we do as respiratory therapists is we basically evaluate our patients. So we'll go in whenever the doctor orders a new drug, we'll give the drug to the patient, and then we'll look at their chart, we'll see if they have any smoking history, surgical history, we'll look at their recent chest x-ray, we'll ask the patient a few questions. We basically do an evaluation on the patient and see what therapies they need, what drugs they need, or if they're getting something that they don't need. So we'll go ahead, we'll make a note about this, we'll send it over to the doctor, and then generally he agrees with us, and then we'll go ahead and we'll just change the game plan up a little bit. We'll add some stuff, take some stuff away, anything of that sort. So another thing is giving drugs. So my drug, the knowledge of drugs I have is just tremendous. So I know much more than respiratory drugs, and that's just from experience working in the ICUs, the floors, things of that sort. So when I'm making these recommendations, I gotta know what drug, the dosage, anything like that. Another thing I do as a respiratory therapist is I would draw blood from patients. Fun, right? Needles. So I have stuck patients with like hepatitis C who had HIV. It is you gotta be a little bit more cautious with, especially if they're jumping and flicking their wrist, anything like that. So what we can read from this blood is the chemistry within the blood. We can read their pH, their CO2, their bicarbonate, their oxygen that's in the blood. Well, basically, this will tell us what the patient needs, what we need to do. So we'll look at the blood, we'll read the results, we'll go over to the doctor, collaborate with them, come up with a game plan, and then just go from there. So another thing that we do as respiratory therapists is we are involved in many of the ICUs. So just the regular adult intensive care unit, the neonatal intensive care unit, the neurological intensive care unit, the cardiovascular intensive care unit. There are much more ICUs than that. However, those are just some that I've been in, that I just got to see many disease processes and how things work, and just great experience as a respiratory therapist before going to PA school is definitely being in the ICU and seeing very critical patients and what they do for those critical patients. So I also have tons of floor experience as well. So throughout the floors, I go ahead and give drugs, I'll give treatments, I'll give therapies, I'll do anything like that. I said it's not as intensive as the intensive care unit, obviously, just by looking at the name, but it needs done. It helps patients out. It's not my favorite, however, I enjoy those days because sometimes they're a little bit more slow. I get to actually interact with my patients compared to the ICU when they have a tube in their throat and they can't talk to me. So respiratory therapists will also do something called pulmonary function testing. So this is generally outpatient. So patient will come in, they're having some kind of breathing issues or chronic lung issues, such as sarcoidosis, asthma, cystic fibrosis, COPD. They'll come in, they'll go ahead, they'll breathe into a tube, and then this will tell us if they're having any restrictions or obstructions, and then we'll read the results, we'll send it over to the doctor, and then they'll basically see what they want to do for treatment for that patient. Pulmonary rehab is another thing we do as respiratory therapists. So this is another outpatient thing. If someone's having trouble at home with daily activities and they just want to get a little bit more comfortable, they'll come into pulmonary rehab. We'll see the amount of oxygen they need for doing things such as cooking dinner, walking up the stairs, going to the bathroom, things of that sort. We basically exercise them a little bit and get them on a program just so they feel more comfortable when doing things at home. Another thing we can do as respiratory therapists is that we run the ventilators, this is also the life support machines. So going back to the ABGs, we will get those, we will read them, and then this will tell us how we need to adjust the patient's breathing, because the patient's breathing has a tremendous effect on their chemistry within the body. So we'll go ahead, we can make small adjustments. However, if we need to make a huge adjustment, generally we need to talk to the doctor or something beforehand. However, just running a ventilator or the life support machine for a patient is just, that's a whole experience within itself. That just looks tremendous on a PA application. Another thing that we do as respiratory therapists is we are involved in something known as terminal extubations. So usually a patient who is intubated, they'll get extubated, which means we just take the tube out, they're good to go, we heal them up, at least their lung issues anyway, that they're good enough to breathe on their own. However, terminal extubations would be if someone has stage 4 cancer and their quality of life is not good. It would be, or it would be unethical for a person to live because they're just gonna die off that vent anyway. We're the only reason that the patient is alive because as soon as we take the vent off, they're gonna pass. So basically, we talk to the family, we get an understanding of that they say it's not right to let this person live anymore. So therefore, we're the ones who pull the plug. Basically, we take the tube out, and then not everyone dies right away. They'll generally take some time. Family will come in. They'll spend some time with them, but we're the ones who pull the plugs. Their family's generally in the room, and they'll remember your face forever. That's an experience within itself as well. I've had to do that a few times. It gets easier with time. I still remember my first one. I don't think I'll ever forget it. So death and dying is definitely something you need to be familiar with as a respiratory therapist because we're in the codes. Not everyone who goes into a cardiac arrest survives that, and then the ICU. Not everyone who goes in the ICU comes out, and then the terminal extubations as well. So depending on the field that you go in for PA school or become PA, you'll have great experience with death and dying already. So if you work in the ICU, the ER, the trauma bay, anything like that, it won't hit you as hard basically when a patient passes away. BiPAP, CPAP, so this goes along with ventilators somewhat. So a patient comes in the ER, we generally will try and put them on a BiPAP before we go ahead and put them on the ventilator, just to see if that'll help. Or if patients have obstructive sleep apnea, we'll go ahead and put them on the CPAP or BiPAP at night. Sometimes you can even work in a sleep study as a respiratory therapist and get that whole experience as well. So we will also transport patients. So we will either do this intra-facility or from one facility to another. So I've only done throughout the facility. So I will generally transport patients from like the ICU down to CT or X-ray, or from the ER up to the ICU or up to a bed, anything like that. However, there are respiratory therapists who will go on a plane or helicopter with patients and transfer them from one facility to the next. I think this would be an awesome experience because you're up in the plane, you're only 2 or 3 other people, and if something bad happens, you need to know what you're doing, so you need to think on your feet. That's another thing as a respiratory therapist. You need to be able to critically think, so that's a tremendous amount of thing for PA school is you have to critically think, you have to know what's going on with your patients, because everything isn't going to be textbook. You're not going to know exactly what's going on just because the person has a certain rash or something like that. So respiratory therapists can also specialize in Ecmo. So this is when the lungs are bypassed or the lungs and the heart are bypassed. So basically the blood will go into a machine, and it'll go right back into the body after it gets oxygenated, and there's a whole process behind it. Well, anyway, you can get specialized in that. Now, I haven't been specialized in that. However, if I don't get into PA school my first year, I thought about getting specialized in it because that was just like awesome for PA school. There are also several other certifications you get as a respiratory therapist that will look awesome as you can go into PA school, such as adult critical care specialist, neonatal pediatric specialist, you become an asthma educator, you can become a pulmonary function technologist, specialist, or certified. Whatever you need to do, that's just looks awesome. For PA school, you just have all these certs compared to just your CNA or PTA again. So, putting unusual gases into a patient. So, this would include things such as nitric oxide or helium. Now, generally, we'll put nitric oxide into a patient who is having pulmonary artery hypertension, so therefore they can't diffuse properly, or the oxygen isn't going across the AC membrane, which is the arteriocapillary membrane within the body. If you don't know what that is, you'll eventually learn it as you pursue your healthcare career. So we give that to patients. We will also give patients helium. So generally we don't breathe in helium, however we do breathe in nitrogen and oxygen by themselves. So helium is less dense than oxygen. It's one of the second most less dense gas compared to hydrogen. So what this does is it basically a person is having an asthma attack, everything is clamped down. So the helium, which is less dense, will go in much more smoothly. Generally, we will do a ratio of 80% helium, 20% oxygen, 70% helium, or 30% oxygen. So these are just a couple experiences I have as a respiratory therapist. Now I could go into every therapy I've ever done, anything like that, but that would be a much longer list, and I've already rambled long enough. So if you guys have any other questions, any comments, leave them in the comments. Anything that I've done, anything like that, anything you want to know, just go ahead and send me a message, follow me on Instagram, anything like that. And throughout this video, I'm not trying to bring down CNAs or PTA aides, because those two things are great experiences for going into PA school. However, this video is why respiratory therapy is one of the greatest things to do before going to PA school. So therefore, I'm trying to make it look a lot better than CNA or PTA aide. So that's why I'm comparing the two so much. But CNA and being a PTA aide, two great things. If those are the only things you can do while going to school, I highly recommend it. So this brings us to our third point. First, you get patient care experience while going to school, or while going to school because you're working full time and you're going to school, so you're getting 2,000 hours if you're working full time while going to school, finishing up your bachelor's or your prereqs. Experience. I talked about all the experience you get, and this leads us to number 3, which is the amount of money you make when working as a respiratory therapist. So I made another video about this, and I said the annual average is $60,000 a year. So that's almost $30 an hour. Now if you compare this once again to CNA or PTA, you're making a lot more than they are. So you can work part-time and go to school full-time and still make a crap ton of money. So this is just one of the great things about respiratory therapy. And number 4, some people do this as a career. Because like I just said, you're making great money, so people will do this as a career. Even if PA school isn't for you, if things don't work out, you get declined too much, you have a great career. You're making good money. You love what you do most likely, because that's why you went to the healthcare field. You like helping people, things of that sort. And then I know I love respiratory therapy. However, this isn't my ultimate goal. But if I wasn't going any further, I would be in love with my career. I made a perfect choice. So if you don't get in your first rounds, like I said, you're still gaining patient care experience, you're still gaining experience, you're still gaining money, lots of money, and you're just growing your skills overall, just making you look like a better PA applicant. So another thing about respiratory therapy is you go to school for this, and throughout school, you're learning everything you will need to know as a PA. So you go to school for biology or chemistry, you may not be learning everything that you're going to need for PA school. So you go to respiratory therapy school, I learned about the body, the drugs, different therapies, and I'm going to learn all about that again in PA school. So it's just one building block off of the next, and it's just going to help me out so much. So this brings us to number 5. The moment you guys have been waiting for, the smartest and greatest thing you can do, and this is the ultimate reason why I think respiratory therapy is the greatest. So this is what I did. I went and I got my associate's degree at a community college for about $20,000, and now I worked almost full-time while going to school for respiratory therapy, so therefore I was able to pay part of my way through school. Therefore I didn't come out nearly as much debt as I would have if I would have went to like Ohio State or something like that. So I worked full time while going to school. My program was only 2.5 years. Once I got out, I started making, and the annual average was $60,000, so I started making great money. And then I was able to pay off my loans, and I was also able to have my hospital finish my bachelor's degree for me, because you need a bachelor's in order to apply for PA school when I only got my associate's. So I could work full time, making awesome money, and my hospital was paying for my bachelor's as well as my prereqs, and I was just paying all my student loans, saving up all my money, and I was just getting ready for PA school. That's what I'm doing now. So I think this is ultimately the greatest thing you can do is go to school through community college for 2.5 years, pay off school as you're going, work full time, work part time, whatever you got to do, get a job making great money, have them pay for the rest of your school, the rest of your bachelor's degree, the rest of your prereqs, anything like that. And plus, you love what you're doing, so, and you're getting tons of experience. You're making awesome progress, and PA schools will look at the quantity of hours as well as the quality of hours that you have as a respiratory therapist. And then once you get debt free, once you finish your GRE, once you finish all your prereqs, once you get your bachelor's done, apply to PA school. And guess what? You're going to look like an awesome applicant. So if you guys enjoyed this video, if you like what I had to say, if you need to add anything like that, go ahead, leave it in the comments. Like and subscribe, guys, and I'll see you in the next one.